program. Welcome to our Heart Healthy Education series, and tonight we will be discussing the fundamentals of interval training. So, on the agenda, we are going to be discussing what is interval training. We'll discuss the difference between mice and interval training. And if you don't know what mice is, don't worry, I'm going to be taking you through that as well. Then we'll talk about the benefits of interval training and some practical applications into our exercise routine. Now, before we jump into the actual topic of interval training, it's very important to understand and appreciate the method of exercise prescription to understand why we do things the way that we do. So we follow a pyramid type protocol where we have three different steps. And in order to move from one step to the other step and to the top of the pyramid, we have to have a solid foundation, which is your step one. The foundation is we first have to establish a routine where we choose an activity of your liking. For most of us, that might be walking. It could also be biking, elliptical, treadmill, whatever it is that you enjoy. And we want to do it consistently throughout the week. So ideally speaking, we aim to get you to do that activity at least 3 to 5 times a week to have that pattern established, to have that routine established, which will be the foundation. Once we have established that pattern, that routine, the next step is we want to increase the volume. And what I mean by increasing the volume is we want to take that activity and we want to try and do as much of it as we can throughout the week. Now, in the case of health and fitness, the research has given us the guidelines of minimum 150 minutes to a maximum 300 minutes of exercise per week. These numbers are not random, right? Decades of research has been done to show us that 150 to 300 minutes of exercise per week will have great benefits to our health. And just doing the first two steps is very crucial, and you're going to see many improvements in your health and a little bit in your fitness as well. So the first two steps are going to help improve what we call your metabolic conditioning or your metabolic fitness, which means it's going to improve your blood pressure numbers. It's going to lower your cholesterol, improve your body composition as well, improve your blood sugar numbers. Along with that, you'll have better sleep quality, more energy levels, right? You're going to see an improvement in your symptoms of anxiety and depression as well. So if you think about the things that I just mentioned, these are all individual risk factors for your cardiovascular disease. So just by having a very good routine where you're getting 150 to 300 minutes of aerobic activity on a weekly basis, you're going to start to see many benefits in your health and a little bit in your fitness. Which brings us to the third step, which is often overlooked by a lot of the individual. The third step is we want to optimize the intensity. So we want to take that activity that we are doing on a weekly basis and we want to try and push you out of the comfort zone just a little bit so that our bodies can adapt and we can see a greater improvement in our health and most importantly in our fitness level. So our body loves to stay in this zone, what we call homeostasis, which is our body's comfort zone. Any disruption in this homeostasis and your body will try and regulate it by doing different things. So for example, the body loves to maintain the internal temperature at about 36 to 37 degrees Celsius. If the environment is hot and your body's internal temperature starts to go up, your body doesn't like it because that's disrupting the homeostasis. So your body is going to start to sweat to try and cool you down to maintain that homeostasis. Similar with your exercise. The moment we start to do our exercise, your heart rate goes up, your blood pressure goes up because your body needs to deliver oxygen to the working muscles, and that is disrupting the homeostasis. So your body is working hard to try and balance it out. Now, once you're done your exercise, you go to bed, you're resting, you're recovering, your body now has a chance to self-reflect. So your body thinks, hey, you know what? Earlier on today, we had a stressor that disrupted our homeostasis. I didn't really like it that much. So perhaps we need to change some things so that the next time this stressor, in this case exercise, is presented to us, we need to be better prepared so that the homeostasis doesn't get as disrupted. So your body goes through what we call tissue remodeling, where your heart is, which is a tissue as well, is going to adapt, is going to get stronger. Your skeletal muscles are going to get stronger. Your joints are going to get stronger. Physiologically, everything is going to change so that the next time you have the stressor, the homeostasis isn't as disrupted as before. So week after week, you start to find that the same exercise that you were doing is now getting easier because your body has adapted to the stressor, and that's how you get stronger. But we want to continuously present it with different types of stressors, so that way your body continues to get stronger and stronger. So the third step is going to improve what we call your cardiorespiratory fitness, CRF, which is the best indicator of health and fitness. The higher the cardiorespiratory fitness, the lower the risk of dying due to cardiovascular disease, certain type of cancers, and other conditions. So we want this number to be as high as possible. How do we measure it? We measure it with something called VO2 max, which is how efficient is your body at taking in the oxygen from the environment, delivering it to your lungs' ability to give that oxygen into your blood, now your heart's capacity to take that oxygenated blood and supply it to the working muscles during exercise, and your muscles' capacity to take the oxygen from the blood and use it for energy. So it's a whole system. We measure it by doing an exercise testing. So stress test, cardiopulmonary exercise testing, these are the different ways that we can test your VO2 max. There are some equations and formulas that we can use, some questionnaires to estimate your VO2 max, but the gold standard is to put you guys through an exercise testing. And with our cardiac population, which is usually done in a medically supervised facility, such as your cardiologist office. Okay, so that's how we measure your VO2 max, which is going to be very, very important in terms of your overall health and fitness. So which brings us to what is interval training. So interval training involves repeated bouts of relatively higher intensity exercise combined with periods of lower intensity recovery. So for example, we take walking, right? So you're going to be doing some speed walking for a period of time, then you're going to slow down for a little bit, then you're going to speed walk again, then you're going to slow down a little bit. That speed walking that you do on the RPE scale, you're going to be in that very hard zone. So you're pushing about a 16 to 17 on that RPE scale. So you're really getting out of that comfort zone. So you're going to be sweating, you're going to be breathing heavy, your heart rate is going to be very high as well. This is where it differentiates between the mice, which I'm going to talk about in just a second. Uh, HIIT training or interval training is also most commonly known as HIIT, so high intensity interval training, aerobic interval training, Tabata boot camp, and the list goes on, right? So all of this, they mean the same type of training right here. Okay. So what is mice then? What is mice? So mice, hopefully, you guys are all doing it on a weekly basis. You're pretty much very, very familiar with it. It's known as moderate intensity continuous exercise, where we are maintaining the same level of intensity for a long period of duration. So such as your exercise walking that you might be doing right now. So on that RPE scale, we're in that somewhat hard zone. So when you come to our rehab classes here, when you're doing your exercises at home, you're typically maintaining the same pace for whatever duration it is that you're doing, 20 minutes, 30 minutes, 40 minutes, up to an hour, right? MICE is also most commonly known as moderate intensity continuous training, steady state cardio, zone 2 cardio, or just cardio. Okay, so those are the same thing. So again, just to quickly recap the difference between mice and interval training. So mice maintaining the same intensity for your entire exercise duration, and with your interval training, you're going to be fluctuating between very high intensity period, then low intensity, then high intensity, then low intensity. So in that RPE scale, you're going to be that very hard, somewhat hard, very hard, somewhat hard for a duration of time. So which brings us to the next question, which is why should you do interval training? What are the benefits? So there are a lot of benefits that we're going to talk about today, but they all result in one thing, which is it is going to improve your VO2 max, which indicates higher levels of cardiorespiratory fitness, which again is the best predictor of your health and fitness. So all of these benefits are going to contribute in improving your fitness level, which is what we want to aim for. So the first benefit that you'll see with interval training is that it's going to increase the function of your respiratory muscles, and it's going to increase your respiratory drive. So The muscles of respiration. So we have our breathing system, right? And it has specific muscles that allow you to do the breathing. A lot of times, individuals with cardiovascular disease, specifically individuals with heart failure, they have a dysfunction in these muscles. So these muscles are not being able to do their jobs properly, which can significantly contribute to exercise intolerance, limiting your ability to do your day-to-day life work, and also decreasing your overall quality of life. So we want to improve them. And what these muscles include, so your main muscle will be your diaphragm, which sits right below your lungs. It's the main muscle that we use for breathing. Then we have the muscles between your ribs, known as the intercostal muscles. These muscles play a very important role in allowing you to breathe during your day-to-day movement as well as your exercise. And then your abdominal muscles, right, which allow you to breathe out when we are doing our exercise or when we are doing our daily activities. So, for example, if you were to take a big breath in through your nose right now and exhale through your mouth, you will feel that your stomach is sinking in. That is those abdominal muscles doing their work, right, to take all that air out of your system. So what the research has shown that 12 weeks of interval training significantly improved the muscle function of these respiratory muscles in older adults with heart failure. Not only it had an improvement in patients with heart failure, but also studies have shown a 43% improvement in the muscle function with interval training compared to a 25% improvement with mice. So even if you're doing mice, you're going to still see the improvement in your breathing and in your muscle function, but the interval training does just a little bit more in allowing us to really maximize the benefits there. It is also going to improve your ventilatory drive and optimize the ventilatory patterns at both rest and during exercise, which is going to improve your breathing efficiency. So what it means basically is that it's going to improve the way the entire respiratory system works. So your body will be able to better maintain a certain amount of oxygen level and carbon dioxide level in your blood. Your nerves are going to be working properly. The muscles are going to be working properly. So your body can utilize the oxygen during exercise and at rest much better, right? So you will see an improvement in the symptoms such as the shortness of breathing that a lot of people feel when they're doing minimal activity. So you go up and down the stairs and you get out of breath. So that is going to get improved with, of course, mice, but it's going to also improve a little bit more with interval training as well, which is again, overall is going to improve the quality of life and help you, get more exercise done as well. So it's going to increase your exercise capacity. The next benefit, we're going to talk about the cardiovascular system, so the heart and the arteries. Is going to increase the parasympathetic activity. So now what is the parasympathetic activity? Before I get to that, I'm pretty sure everyone has heard the response flight and fight response, which is your body's natural response to an emergency situation. So for example, if you're ever driving and someone cuts you off and you almost get into a crash, your heart rate goes up all of a sudden, right? You start to maybe sweat a little bit and you are alert and you're very focused. That is the flight and fight response kicking in, so that way you're ready to respond to any emergency situation that comes in front of you. In that response, your heart rate is high, your blood pressure is high, right? Your body is in a emergency mode, so your body is stressed. A lot of times because of chronic stress, so it could be family issues, could be health issues, financial issues, your body continuously stays in that stress. Even if you're not in any stress, your body just assumes that, hey, I'm in an emergency situation and I need to stay active, that something might happen. That can lead to your heart rate staying high constantly, your blood pressure staying elevated constantly. And as we know, having high blood pressure, having your heart rate very high even at rest, can cause damage to the heart. That's why a lot of us might be on medications such as beta blockers to lower the heart rate, to lower the blood pressure, right? So with interval training, you're going to see an increase in the parasympathetic activity, which is the opposite of the sympathetic nervous system. So it's going to turn off that flight and fight response. So your heart rate at rest is going to be lower. Your body is going to have a chance to recover. So studies have shown that interval training improves what we call the heart rate variability. So what is this variability? So there is a variation in time between each heartbeat. So for example, if your heart beats 60 times in a minute, The time between each beat might not exactly be 1 second. Sometimes it might be slightly more, sometimes it might be slightly less. And this variability is a sign of how well your body is managing stress, how well your body is recovering. So for example, right now at rest, your heart rate should be low. The moment we stand up and we start to do our house chores, the heart rate should increase a little bit to accommodate the need of oxygen, because your muscles are doing the work. You're maybe doing laundry, maybe you're doing a little bit of moving around the house. So your heart rate will naturally go up a little bit. You start to exercise, your heart rate needs to go even higher because the oxygen demands are now high. When you're done your exercise, you sit, your heart rate should come down again. So there's fluctuations in the heart rate is what the variability is. And the higher the variability, the better it is for us. The lower the variability, if your heart rate is constantly staying high, it does not have a chance to adjust to the different moments in our day. That shows that perhaps our body is in stress and it's not functioning at its best capacity. So interval training is going to help improve that. Interval training is also going to increase, so studies have shown that increases peak cardiac output after 10 sessions. So what it means, cardiac output is how much blood is being pumped out every minute by your heart. So it's going to increase the amount of blood which is being pumped out every single minute with less work on the heart. So your heart is going to become more efficient. It's going to do the same amount of work or more work with less effort, which is what we want to do, which is what we want to aim for, right? The heart does more work with less pressure, so that way it has the ability to rest and recover. And then lastly, studies have also shown to reduce the arterial stiffness in patients with metabolic syndrome. So what is your arterial stiffness? So as you know, we have arteries that go from the heart to the entire body to supply the nutrients and oxygen to the rest of the body. The arteries are supposed to be very elastic, right? They're supposed to dilate and constrict on demand so that the blood flow can stay smooth throughout your life. Over time, because of various types of cardiovascular disease, aging, the arteries become very stiff. And physical inactivity is one of the reasons why the arteries become stiff. So they lose that elasticity. They cannot constrict and dilate on demand, and which can increase the amount of work that your heart has to do. So your heart has to work very hard. It has to beat very hard. It has to beat faster to try and push that blood towards the rest of the body. And it can also increase your blood pressure. And as we know, if the heart is constantly working very hard, over time it can get weak, and that can lead to heart failure. It can lead to different types of arrhythmias, and it can also lead to hypertension. And all of that are, again, risk factors. All of that are very bad for the health. So with interval training, your vascular function is going to increase, your endothelial function is going to increase, and your compliance of the arteries is going to increase as well. So your arteries are going to stay healthy, and they're going to be able to dilate and constrict very easily. And the last benefit that we're going to talk about tonight is that it's going to increase what we call your capillary density, mitochondrial content and function, and ability to utilize oxygen, utilization of fat and glucose. So in simple terms, it's going to make your muscles more fatigue resistant. So like right now, a lot of us might be doing an activity and you might be feeling very fatigued easily. You might be getting that burning sensation in your leg with a little bit of walking. So over time, with interval training, it's going to increase your muscles' capacity to stay fatigue resistant. So you can do the same activity for a longer duration of time. It's also going to increase your body's ability to utilize more oxygen. So early studies in the 1990s have shown that interval training increased the total muscle fiber quantity in your muscles, and it also increased the proportion of type 1 muscle fibers. That type 1 muscle fibers are those muscle fibers which make your muscles fatigue resistant. Okay, recent studies, so such as a TAN study, showed that 18 HIIT sessions over the period of 6 weeks led to an increase in type 1 and type 2 muscle fibers. It increased the capillary density and the oxidative capacity markers in women. So similar results were also found in men as well. So again, it's going to make your muscles more fatigue resistant so that you can do your day-to-day activities more easily, and you can do your exercise more easily as well. It's going to allow your muscles to take in more oxygen from the blood and use it for energy. So there's no more wastage, right? So your body is working at peak capacity. Now, one thing that we want to keep in mind is that interval training is something fairly new in the field of cardiac rehab. Athletes have been doing interval training for decades. and it has been a very fundamental way of training to improve their fitness level. However, in the field of cardiac rehab, we have to be careful because it is a little bit of high intensity training. We are cardiac patients with different types of cardiac conditions, so we want to make sure that when we are doing this type of training, that we are taking a lot of safety considerations, and which we'll talk about in a bit. But more research and is needed to really understand the long-term impact of cardiac rehab and interval training. But overall, the studies which are right now coming out are showing that mice, so your moderate pace exercise and interval training are either equivalent in benefits, or interval training is a little bit higher in terms of offering some of the benefits that we just discussed. No studies have shown that interval training is worse. So either it's equivalent or it's better at providing benefits to the health and fitness. So let's talk about some of the safety considerations. So once you are ready to do your interval training, if you fall in the green zone, you're okay to start your interval training. You are someone who wishes to try interval training. So if you're someone who wants to try it, you can do it. If you don't want to try it, don't do it, right? Don't make me, force you into doing something that you don't want to do. The other most important thing is that you are compliant with your MICE training for at least 8 weeks. So you've been doing your exercise walking 30 minutes at least 4 times a week for 2 months before you start to do your interval training. So we want to make sure, again, that we have that solid foundation before we try any of the higher intensity exercises, okay? And your goal is to improve your fitness level. If you're always striving to improving the fitness level, then interval training is something that is going to be very beneficial for you. Some of the instances when interval training might not be appropriate for us at this stage include evidence of ischemia on stress testing. So if you do your exercise stress test with your cardiologist and they tell you that, hey, you have a positive stress test, which means is that they have noticed that a part of your heart is not getting enough blood with exercise. In that case, we don't want to do interval training because it might make you symptomatic with exercise. If you have any symptoms of angina, so if right now you're doing your exercise walking and you get any chest discomfort, then we don't want to do interval training at this stage because, again, we want to stay safe when we do our exercises, right? So we want to just focus on first resolving the symptoms of angina, and once that has been cleared out, then we can revisit the interval training. If you have any type of hypertrophic cardiomyopathy, which basically means that the heart muscle becomes thick, so the left ventricle isn't able to pump out the blood as efficiently to the rest of the body. If you have a condition like that, if your left ventricle isn't as optimal as it should be, then we want to avoid doing interval training at this stage. And lastly, if you have any moderate to severe aortic stenosis, so aortic valve, which is one of the major valves in your heart, if there's any type of stenosis in the valve, so any issues with the valve, we don't want to do interval training at this stage. Now, this contraindications here, they need to be discussed with your cardiologist. So if you have any of the following, then it has to be looked at a case-by-case scenario. So in that case, you want to have that conversation with your family doctor or your cardiologist before you attempt to do interval training. So what are those contraindications? So any cognitive impairment, any vascular aneurysms or spontaneous coronary artery dissection, also known as SCAT, which is more common in women. And so in that case, you want to speak to your cardiologist. ICD implantation, significant arrhythmias, moderate to greater falls risk, and any orthopedic issues. So any joint pain, any such as like hip pain, knee pain, or ankle pain. All of these cases, we want to make sure that you have that conversation with your cardiologist or your family doctor before we do any of the interval training, as sometimes it can make the symptoms worse, but sometimes you're okay to do it. Like a lot of times, people with SCAT, I've personally have patients who were a patient of SCAT and they were okay to do interval training. Also, they had arrhythmias, but the cardiologist was not too worried and they cleared them to do their interval training, right? So in that cases, you just want to get that okay from the cardiologist. And if you're ever unsure, if you are like, hey, I might be in the green zone or I might be in that yellow zone, I'm not sure, just talk to your cardiologist, get the clearance from them, okay? So now let's talk about practical applications. How can we put interval training into our exercise routine? So we'll talk about the FIT principle, and then we'll talk about some of the researched different protocols, and then I'll give you my personal recommendations. So frequency, we want to do about 2 to 3 times a week on non-consecutive days. So we don't want to do interval training every single day. We don't want to do them back to back as well. We want to have at least 1 day of gap in between. But along with doing your interval training, you want to still do 2 to 3 days of your moderate intensity exercise. So you still want to do that long 30 to 40 minute walking that you might be doing. And then you want to add in interval training as well. Intensity. So the higher intensity intervals should be at about 85 to 95% of your peak heart rate. So if you have done your exercise testing, you know what your maximum heart rate is. You can take 85 to 95% of that heart rate, and for that high intensity interval, you should be in that zone. If you haven't done your exercise testing, not a problem. You're going to follow the RPE scale, and for that high interval period, you're going to be in you want to be around that 15 to 17 RPE zone. For the lower intensity interval, you want to be at that 50 to 75% of that maximum heart rate, or a RPE of 12 to 14. So again, for example, if you're doing your walking, you're going to walk at a slow pace, so RPE of 12 to 14. Then you're going to walk at a very high pace, which gets you to that 17 zone, so that very heart zone. Then you slow down again, then you go up again. So that's how you would gauge that RPE if you don't know your heart rates. Type. So there are many different types, and this is very individualized as well. The simplest way to introduce interval training into your routine is you're going to speed walk, and then you're going to do a moderate walking. Speed walk, moderate walking. So for some individuals, it might be a walk and then a little jog, a walk and a little jog. For some individuals, it might be a jog and a run, jog and a run. So it can be modified and put into place very, very, versatile, very different ways that we can do it. We don't need to do all those fancy exercises that we see on social media. You don't need to flip tires. You don't need to do burpees. You don't need to do the clean and jerk. We don't need to get all crazy. We want to keep it simple. We want to keep it safe. Okay. So that's how we're going to introduce interval training into your routine. And then the time, again, many different ways that we can prescribe interval training. The lowest interval can be 10 seconds of high intensity, 10 seconds of low intensity, up to maximum of 4 minutes of high intensity and 3 minutes of low intensity, right? And now we'll talk about the three different protocols which have been researched very widely, and then I'll give you my personal recommendations at the end as well. So the first protocol is known as the Norwegian protocol. Now, there is no particular order. I'm not saying that just because this is the first one, this is the best one. Okay, so we're just going to go through all three protocols. So what the Norwegian protocol is quite famous in the European countries. It's also known as a long interval. So what you're going to do is you're going to do 4 sets of high intensity work for 4 minutes, combined with 3 sets of 3 minutes of low intensity intervals. It's going to be about 25 minutes of work, and this is what it's going to look like. So you're going to start with your warm up right here, the blue bar. Then you're gonna do 4 minutes of high intensity work. So it could be biking, could be walking, whatever activity that you enjoy doing. Followed by 3 minutes of lower intensity work. Then you go back and you do 4 minutes of high intensity, 3 minutes of low intensity, 4 minutes high, 3 minutes low, the last 4 minutes high, and then do your cool down. Okay, this is the first protocol. I don't recommend that you start here. 4 minutes of high intensity work, that's going to be very, very difficult. 99% of our patients are not going to start here. You can build your way up to here, but we're not going to start here. But this is one of the ways that we can do interval training. And again, it has been researched quite heavily as well. The second protocol, also known as the medium interval, you're going to do 2 minutes of high intensity intervals 8 times, combined with 2 minutes of low intensity intervals 7 times. So it's still about 25 minutes of workout, excluding the warm up and cool down. And this is what it's going to look like. So you're going to do your warm up, 2 minutes of high intensity, 2 minutes of low intensity, until you have completed 8 of the high intensity intervals and 7 of the low intensity intervals. And then you do a cool down at the end and you're done. Okay. So that's the second protocol. The third protocol, which is also known as the short interval, it is 1 minute of high intensity interval. You're going to do that 10 times, combined with 2 minutes of low intensity intervals 9 times. Approximately 30 minutes of workout, excluding the warm up and cool down. So right here is what it's going to look like. you're going to do a warm-up. Sorry, I have a comment saying not on screen. Can everyone see my screen clearly? Just give me a thumbs up if you can see the slide. Yeah, I see some thumbs up. I see one no, but I see a couple of thumbs up. Okay, I see a couple of thumbs up here. If you're having difficulty looking at the screen, maybe just log out and log back in and see if that can resolve the issue. So over here, the short interval training is what it's going to look like. You're going to have the warm up, then you're going to do 1 minute of high intensity, 2 minutes of low intensity until you've completed 10 high intensity intervals and 9 low intensity intervals. And then you're going to finish up with your cool down. And whenever you're doing your interval training, you're going to follow the same protocols. You always start with a warm up for at least 3 to 5 minutes, and you always end with a cool down. Any symptoms during exercise, you stop exercising. If symptoms get worse, you seek medical attention. And then any event of emergency, you call 911, right? So that is standard. That does not change. Now let's talk about some of Hasnain's recommendations, what I recommend, how I would prescribe interval training, and how I have prescribed interval training to some of my patients. So the first week, if you're brand new to interval training, you've never done interval training, this is what you're going to do. The first 2 weeks, you're going to start with 10 seconds of high intensity interval, followed by 20 seconds of low intensity interval, and you're going to repeat it 5 to 10 times. So you're going to walk fast for 10 seconds, do a moderate walk for 20 seconds, and you're going to do that 5 times, maybe 10 times. Okay, not more than 10, perhaps not less than 5. That's a good way to introduce interval training for the first 2 weeks. The third and the fourth week, we're going to go a little bit more. So we're going to do 20 seconds of high intensity work, and then we're going to do 40 seconds of low intensity work. Same thing, you're going to do that 5 to 10 times. And you're only doing this once a week right now. Okay. The fifth and the sixth week, you can either do a 30 seconds of high intensity work, followed by a minute of low intensity work, again, 5 to 10 times, or you can do 45 seconds of high intensity work and a minute and 30 seconds of low intensity work. So as you can see, the high intensity work is 30 seconds, so the low intensity would be double, so it would be a minute. So you want to do that 1-to-2 ratio. The seventh and eighth week, you're going to do 1 minute of high intensity work, followed by 2 minutes of low intensity work, 5 to 10 times. If you look at the seventh and eighth week, it's the third protocol right here. So we build our way up to the third protocol. Okay, so in 2 months' time, if you're progressing well, you can go and build your way up to the third protocol. Once you get to the third protocol, the next step would be that you maintain the high intensity work, but you start to lower the lower intensity work. So you do 1 minute of high intensity work, and perhaps you go down to 1 minute and 45 seconds of low intensity. After a couple of weeks, you go down to 1 minute and 30 seconds of low intensity work until you go to 1 minute high intensity, 1 minute low intensity. So that would be the 1-to-1 protocol. And then we can build our way up to the third and the second, the medium interval, and then eventually the Norwegian protocol. But again, just start here, right? This is your key. We want to have that solid foundation. We don't want to rush this process. We want to take our time. We want to keep it safe, and we want to enjoy the process. The reason we like to do interval training is, of course, the benefits are great, but it also introduce is a new type of exercise to keep it a little spicy. You know, a lot of times we get bored with doing the same type of exercise. So this is one way to kind of spice up your exercise routine. Or if you're running low on time, this is the best way to get in a quick workout as well. Because if you do the 10 seconds high, 20 seconds low, 5 to 10 times, you'll be done within 10 minutes, right? Including your warm up and cool down. So if you're running low on time, you're like, hey, I just don't have the time today to do my exercise. I'm just going to do a quick interval training. And that's what I do most of the time, because I'm working long hours sometimes. Sometimes I'm studying and I'm like, I don't have the time to go out and do a 32-minute walk or a 40-minute walk. So I'm just going to hop on to either my exercise bike, or I'm just going to go out and do this type of interval training. So it's a very quick and efficient way to get your exercise in. So again, no more reasons to say that I don't have the time to work out, because you've just been taught how to do a quick workout as well, right? So next time your therapist asks you, hey, you cannot use the the excuse that I didn't have time, because they were like, if you attended Hasnain's talk, you definitely had time to do at least a quick interval training there. So we're going to quickly go over the recap. We're going to talk about just review what we did. So HIIT and MICE both are going to help improve our health and fitness in terms of our cardiac rehab. And HIIT has shown to be a little bit better at improving some of the benefits, right? So some of the things that we discussed, so we're going to see a better improvement in your fitness level, better improvement in your VO2 max. But MICE is still a fantastic way to really see and improve your health as well. So do not neglect MICE. And if you cannot do HIIT, don't be discouraged. You can continue to get the same benefits with your MICE training as well. So that moderate intensity exercise training. Safety considerations are our number one priority when you're trying your HIIT interval training, right? We want to make sure that you are staying safe when you do your exercise. We want to make sure that you stay asymptomatic, so no symptoms during your exercise. We don't want, we want to stay away from all the symptoms, right? We don't want any symptoms during exercise. If you're unsure, always speak to your cardiologist or your family doctor. If you're still in the program, speak to your exercise therapist before trying to do interval training. Start with once a week and build your way up to 3 times a week, no more than 3 times a week for your interval training. Start with smaller duration of high intervals and build your way up. So start with that 10 seconds. Some of you might be able to start with 20 seconds, but do not directly jump into that 1 minute interval, right? We want to slowly introduce it. We just want to see how your body reacts to it, how your body adapts to it. And if you have any symptoms the next day, or if you have any, extreme soreness or pain the next day, then we want to always regress back. So don't start with the very high intensity or the very long duration. Start with 10 to 20 seconds and then build your way up every couple of weeks. And as one of my mentors used to say, simple things done savagely well. Matt Nicol. He's one of my mentors. He was the strength and conditioning coach for the Toronto Maple Leafs. He now has his own practice where he trains NHL athletes. He trains a lot of the Olympians. And I worked with him for a little while. And a lot of times, these NHL players would come in and they would show him that, hey, you know what? Look at this fancy equipment. Look at this fancy type of training. When can we do this? And he would always say, simple things done savagely well. You take the simple activity, you do it really well. You're going to see major improvements in your fitness, in your skill, and in your health, right? So we want to keep things simple, stick to that walking, stick to the biking, stick to the elliptical. Don't, flip tires, as I mentioned. Don't go slamming those hammers on the tires and try and get the interval training that way, right? Keep it very simple and keep it safe. If you have any other questions, speak to your exercise therapist if you're in the program, or your primary care physician. If you have any feedback, please email me. My email is on the slide right there. So it's hcheriwala@shn.ca. I'll also put it in the chat as well. We always love feedback. This is the first time that we've offered a education topic like that. So if you guys enjoyed it, we want to know, so that way we can offer more topics like that. If you didn't like it, let me know that as well. So next time we don't offer it, right? We are here for you. We want to hear what you guys want to learn about, right? And again, visit our websites for all further education, which are scheduled for the month of September. And thank you so much for joining. I hope you guys enjoyed it. And if you have any questions, I'll take them now.
Thank you, Hasnain, for that informative presentation this evening. We'll go into the question and answer